guys, welcome back to Medical Coding with Blue. Today's episode is all about, do medical coders perform medical billing activities as well? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this comment, I'm gonna read the comment and then we're gonna get into it. So here we go. So the viewer says, hi Blue, some job openings combine medical coding with medical billing. These are two different functions, right? So why combine? Should medical coders also do work on accounts receivables? See this a lot in the job listings for medical coders. Okay, so first of all, yes, medical coders and medical billers are two different duties, okay? But depending on the size of the facility or the size of the doctor's office, the size of, wherever you're trying to code at, sometimes it doesn't require multiple people. So what happens is that facility will say, well, we have the funds and the budget for one person, so this person will do the coding and the billing. Because as coders, we are tested on reimbursement, which means, and we all took a medical billing course as well when we go through these programs, and even if you study independently, you are still learning about medical billing. However, if they say, okay, well, you need to be the biller and the coder, that is going to require a higher level of pay when it comes to that, because you're combining two different roles. Because most of the time it's a biller and then a coder. The bigger the facility, it will be two different people doing this function. However, again, sometimes it depends on the facility, and sometimes it depends on the individual running the facility. Sometimes they don't know that it can be two different people because they think automatically when they hear medical coder, oh, this person is a biller. In my instance, I have been a medical coder for 16 years. This means I have never once submitted a claim. The codes that I have selected have been the codes that are submitted on claims, but I personally have not been the one to submit the claims. Okay, so when you're looking at these job listings, they may say, oh yes, this person, we have a position for a coder, and they must also do the billing, they must also do accounts receivable, they must also do follow-up, they must also do denials management, they also have to do prior authorization, right? Because prior authorization is typically what the billers would be doing, or even some of the front desk staff, they will be doing that as well. So it really all depends on what that position is going to require that person to do. But here's the thing, guys. Remember, you are also in the driver's seat when you are applying for these jobs. So if you are seeing in this job listing that this person is doing the coding, they're doing the billing, they're doing accounts receivable, they're doing prior authorizations, they're doing insurance checks, they're doing all of these other things, denials management, all of these things, they have a whole list of duties that you are doing as the medical biller slash coder, or as a medical coder slash biller. That may not be a position that you want to apply for, because they're obviously trying to get the most work that they can out of one person. Now, depending on how big that organization is, that facility is, this is why I tell y'all to stay out of these private doctor's office. Just stay out of the private doctor's offices, guys, because it's often in the private doctor's offices that they're asking you to do more than one hat, okay? And as coders, we should just be focused on the coding, okay? And especially when you work for a big organization, you have your position as a coder. Your position as a coder will typically be just the coding. You will do the coding. You will work the denials, because again, you are selecting the codes, you're submitting it to the billers are submitting it to the insurance. It comes back, maybe there's a denial, maybe there was a code update, or maybe a modifier forgotten, okay? And so the biller will send it back to you for review. So you're working those denied claims, and then you say, okay, yes, I just need to add a modifier, and then now here, I'm gonna send it back to the biller, we can send it for resubmission, and then we can send it off to the insurance company. But that's the duty of the coder. So they're working denials management, they're doing the coding, working denials management, they're also doing the provider education. And sometimes the coder doesn't do the provider education. It's the CDI that will be responsible for provider education. They will be responsible for that. Or sometimes they have a person that does specifically physician education. Not all facilities have a person designated as a physician educator, but the facility that does have a designated physician educator is one that really understands how important it is to stay on top of these providers as far as their education goes. Anytime there's an update with the coding, that the providers are right there on board and they are being educated immediately. So that way they can be updated in real time along with the coders, okay? So again, depending on what that facility is asking you to do, if it is your desire to just be a coder and not have to deal with all of the things with billing, look for those positions that are not going to require it. In all of the positions that I have had four, four positions as a coder. And in each one of these, I looked at the description, the job description. And anytime I had looked at these job descriptions, anytime they had said anything about billing, anything about accounts receivable, that's not the position for me, because I am not a biller. I am a medical coder. Do I understand about reimbursement? Absolutely, because that's part of my job to understand. Does it mean that I actually do this? No, and I don't have to. I don't have to deal with patients as a coder either. I don't have to collect money from them. I don't have to post payments. I don't have to do none of that because that's not in my job description. In my job description, actually, it is just coding, right? I do outpatient services coding. That's what I do. That's what I do. Provider education is part of my my duties as assigned. It is part of that. But that's the thing, guys. I don't mind doing provider education. I enjoy that. But again, could I do billing if I wanted to? Sure, absolutely, I could do that if I wanted to, because again, I am a person who likes to learn, all right? But there's people that don't want to do that. They would rather not deal with the billing, so they only want to do the coding. So when you're looking at these job listings, if it starts to mention AR and all these other things, don't apply for that job. It's as simple as that. Do not apply for that job, because I guarantee you there's a lot of places that you could be applying that are not going to take advantage of you. Because I have seen some job listings for they say medical biller / coder, and then when I start looking at it, the job description, it'll say, oh, that they're looking for somebody who will do the coding, denials management, submitting claims, checking in patients as needed. Excuse me? Say what? Say who? Checking in patients as needed? No. And, or doing prior authorizations, verifying insurance. Okay, I could see that if you're the biller, but then again, what is the front desk doing? Unless you're working the front desk, now they have you working all these hats. No, ma'am, no, sir. I don't think so. I am technically trained. I don't need to do all that. And you have that choice, guys. You have that choice. Believe it or not. You, just because you're looking for an entry-level position trying to get your foot in the door does not mean you need to be taken advantage of. Period. It does not mean that. It does not mean that you have to subject yourself to working in places like that will use you for all the skill that you have. And for those people that say, well, they're not hiring me for a coder, but they said that I could be the secretary and they'll let me select the codes. Okay, again, no ma'am, no sir. Why? Why would you do that? Because to be a medical secretary is a lot. That's a big job in and of itself. And then you want to add on a coder. Well, guess what? Now that you've built your experience in coding, do you think they're going to let you go? Especially if you're really good as a secretary. Do you think they're going to let you go and be a coder somewhere? Heck no. Why? Because they got 2 positions out of you. 2. And to save all that money that they would be able to save, because they don't have to pay you a medical coder salary, they can pay you a secretary salary, which is less than what a coder would make. Think about that. And I'm talking about a coder who has experience for those of you who want to get all hiffy, calm down. I'm saying this. For those that have experience in coding, they're going to make more than a medical secretary, okay? You get into higher levels, it's not a medical secretary anymore, that's an executive assistant, and that is something completely different, okay? I'm talking about medical secretaries, right? Or even the front desk people, okay? That's what I'm talking about. They don't make what a medical coder makes, okay? So again, we have the responsibility as job seekers to look at the job listing and see what it all is asking for in that position. And then when you're going in there for that job interview, you can ask them, what does this position entail? What does a typical day look like for somebody in this position? If they say, well, you know, you're pulling the report that tells you what encounters to code for, you're coding those encounters, you're sending queries, you are following up on queries, you're performing provider education. Again, that's all reasonable activities for medical coders. And if you're applying for a medical biller position, and then you say, well, what are the typical activities? What does a day look like for a medical biller? And they say, well, as a medical biller, you are getting the claims, you're making sure that all the information is correct and everything is filled in and everything looks good, and then you're submitting the insurance claims to the insurance company and you're doing the charge entry and things like that, and everything's good there. Okay, that's reasonable. That's reasonable for the biller. And then you're having to manage the denials that come in. You will send them back to the coder, or if they say, well, we don't have a coder, you will be doing the billing and the coding. But the codes will already come to you already all done, because we use the electronic health record or computer assisted coding to help us to do the codes. That means that as a biller, you are responsible for the coding. That means that your position is going to be a little bit more hectic, because not only are you going to look at these codes that are pre-selected, you got to make sure that that documentation supports, because everything's going to be on you as a biller coder, okay? And then if it's not, then you need to go back through and you need to select the correct codes, the diagnosis code, the correct procedure code, and then that's when, then and only then, are you able to submit the claim. Now, they may have you on productivity where you have to produce a certain number of those, and if there's too many mistakes, then it's going to be you that has to go over there and educate the provider. Again, I typically see this from small doctor's offices that try to pull this, where it's one person that does the billing and the coding. If it's one provider, you may be able to get away with it, because the workload for one provider is manageable sometimes depends. But again, if it's a practice of like 3 or 4 or 5 doctors, no. And you're doing all of that, that's too much. That's too much. And that's not the place for you. Okay. So you don't have to respond to these places that are looking for somebody to do 10,000 tasks for this one position. Okay. Let's use common sense there on that one. All right. Don't do that. Don't wear yourself out. Don't bring yourself out saying, well, I just need to get experience and I need to get my foot in the door. You don't have to go through all of that. That's what I'm telling you. You can find positions that are just in coding, or if you want to start in billing, they are just in billing. Okay. And then if it happens to be, well, we need you to do a little bit of coding, like if it comes back and it's denied, and then you can add the modifier or change the code for something more specific. And it's something that's manageable. As far as like the number of claims, okay, ask them about the number of claims there are. And if it's something that you think is manageable and reasonable, right? Under 200, okay, something like that, where most of the codes are already correct and is basically the same thing over and over again. And then you may have to do 1 or 2 changes here or there, or not 1 or 2, but just a few changes here or there. That's okay. You can do that. You can handle that, And again, it makes you look even more well-rounded because you did all that. But if it's for a practice with multiple providers, no, not unless there's other people in that department that are working with you. You're not just by yourself. Then that's okay. If you're not just by yourself, that's okay. Okay, but you need to make sure that you ask. Okay, so that way they're not trying to squeeze as much productivity out of you as possible. It is reasonable for them to set a standard of what they want. However, being new, you need to know and understand what your tasks are as a coder. As a coder, you're going to be coding, you're going to be querying, you're going to be educating. As a biller, you're going to be submitting, you're going to be on the phone to the insurance, you're going to be working denials. Okay, those are things that are typical of, those positions. So when you're looking at that, think about that. But if the position starts to involve patient interaction and things like that, like checking in at the front desk, or they say helping out with setting up the rooms and things like that, no, they're just looking for somebody to do everything. And no, you don't need to be doing that. That's a quick way to burn yourself out. That's a fast way to run yourself off from this industry. And the only one who will have ran themselves off is you. You are responsible for that. I got somebody who had sent a message, or they had posted a message complaining that the position for billing was boring and they have ADHD. Okay, well, that was weird. Very random that they said that. But again, it's not going to always be flashy. It's not always going to be the most glamorous thing that you're doing. And sometimes when you get into these positions, they're going to be repetitive. But again, the times that you want to say, okay, well, there's a little bit of variety here, is like if you're in the coding and they say, well, you're not just going to do one specialty. We're going to switch you around so that way you can get training on all specialties. That's something that's beneficial to you, because that's going to help you become a well-rounded coder. Then you will be able to code anywhere. Okay, and that's giving yourself the opportunity to have more opportunity for later on. And same thing for the insurance company and the billing side. If they're saying, well, we don't only deal with Medicare, we deal with other commercial insurance as well. The different insurance companies that you deal with, the more companies that you deal with, again, the more well-rounded you'll be. However, it's a lot to study as well, because you have to be familiar with each of these nuances for these different insurance companies. So that's something that you need to think about. But again, making sure that that position is just focused on what that would typically do, what that position would typically do. And for my billers, you're going to have to get on the phone with the patients. Sometimes you do, sometimes you don't. But most of the time you will be dealing with patients. Sometimes they're going to have you doing accounts receivables, right? And working to set up payment plans and things like that for patients. Just think about how you would feel if you were sick and you couldn't pay your bill and things like that, or you didn't have a lot of money and you needed to work out a payment plan. Be as patient with them as possible, and when you can and you can find resources to help pay for those bills, because there's lots of resources out there that are designed to help pay for patients, for their care and things like that. And sometimes with the pharma companies, they'll help as well, depending on what it is. Sometimes you may have to reach out to them. That's something that you can do, and that's something that you can do to help bring revenue in as a biller. Okay, and making sure that the money keeps coming in. Okay, because those receivables is a big part of it, and being sure to manage the money and make sure that you manage it well, and always make sure that you know what you're doing when it comes to patients who are doing cash pay, or patients who are it's going through their insurance. You have to understand both of those. And you do not, as a biller, you do not get the luxury of deciding what you do and don't want to do. I saw a thing on Instagram where somebody thought that was cute. Well, I don't feel like doing, cash pay. So sometimes I say, oh, the system's down. Excuse me. And she said that right in front of her boss. And I'm like, I hope he gets rid of you. Because the thing is, you have no right to do that to patients. To say, oh, we can't do that right now because the system's down, and it's not really down. That's a lack of integrity right there. And that I would not put up with as a provider. And that's just me. Or even as the office manager, I would not deal with that. Somebody who admits that and then just thinks it's funny and thinks it's cute. Heck no. That would be the first person I would get rid of. Because again, everything revolves around the patients. And when these patients are paying and things like that, and paying cash and things, and you want to sit here and play games, oh no. No, no, no. But that's just my advice anyway. So, but if you ever find yourself like that, you don't want to do certain things, get out of that job. Get out of that job, because that's clearly not for you. And you're gonna end up affecting somebody. You're affecting the provider's money. You're affecting the patient being able to be scheduled or whatever, because you don't want to do it right now. Does that make sense to you? That's a loss of business that can happen right there. Okay, so you don't want to do that. It is about making sure that when you are in these positions, you know what you're supposed to do in these positions. It's the same thing for the people who check in the patients, who are manning the front desk, and they are doing this. Maybe they don't know about coding, or maybe they don't want to do coding, and they're doing front desk work. Those front desk workers, when they're checking in patients, they should be getting the patient's insurance. They should be verifying the patient's insurance. That's part of what they do as in their positions, okay? And so they got to make sure they verify the insurance. If they're doing prior authorizations, they need to make sure that they're doing that. They always need to ask, because sometimes patients get insurance, they have secondary insurance. You got to ask them about the secondary insurance, because again, money gets lost because people don't collect this information. And they say, well, I didn't know. Just because you don't know doesn't mean you can't do your own research, okay? Ignorance is not an excuse for anything, especially when it comes to healthcare and being in this industry, particularly in health information, okay? So even for me, that I don't work in those positions, I still know what they do. And I still have a good idea, a general understanding. I may not know all the details, but I do have a general understanding of what they're supposed to be doing. And that's something that you need to have, okay? So again, if the position is asking you to do too much work, that's not the position that you want. If it seems to stray too much from the norm of what you would be doing in that position, don't apply for that position. And I understand helping out your co-workers here and there, but if that's what you're supposed to do, not if that you're just gonna help set up the room, but you're a coder. Does that make sense to you? You're gonna go clean the room and set it up and things like that. Okay, so now you have to know and understand about like hazardous handling and things like that. Do you want to do that? Is that something that you want to do because somebody thought that they're going to try to squeeze as much productivity out of you and as much tasks as they can do, because then they're not going to have to hire somebody else. They'll let you do it. Again, it's something to think about. So I did get quite a few people that had responded on here, and I said that this was a good topic to do. So I went ahead and decided to do this today. But yes, be on the lookout for those things. You don't have to be subjected to all of those unnecessary tasks, okay? And again, it's one thing if it's something to make you a more well-rounded coder, like you're doing different clinics. That's something completely different. You should be trying to do every single clinic to help you to understand, okay? There should be no reason that you've been in the same clinic for 20 years. That's ridiculous. And you never tried to do anything else, then you just basically wasted a 20-year career when you could have really made yourself well-rounded. Just saying. So again, with that said, think about what you're doing. Ask these questions. What does a typical day look like? What are some of the tasks that are going to be asked of me? Am I going to be able to grow in this position? Okay. Does the person who learns all these things, are they in charge of training other people? Getting experience training other people in coding, or getting experience training other people when you're a biller, that's a really good thing. It's another feather in your cap as well, because even though people say, well, I don't like to train, it doesn't matter what you like. Okay, it doesn't matter what you like. It is what the position is requiring of you. And if it's not something that you want to do, if it's not something that you feel comfortable with, that's probably not the position for you to begin with. Is that even the career path that you want to pursue? But again, if you want to sit here and say all these things that you want, but not make any concessions and not meet anywhere in the middle, how are you ever supposed to grow as a professional? That's my question to you. Think about that. How are you ever supposed to grow as a professional if you are not willing to do other duties but related to your position? Again, if it goes out of your position, that's not what you do, okay? And you can say that especially if it's in your position description. All right, you can look back on your position description, and if it does say other duties as assigned, we need to make sure that it's reasonable to your position. And again, if they're trying to push you to do all these other things that is out of your scope of duties, I would be looking for another position. As you are able to get that position, you can get another one. Okay, you should never be subjected to anything that's outside of what your duties are. Okay, at least that's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. But yes, keep an eye out on those job listings. And again, if it sounds like it's too much, don't apply there. Because as they are interviewing you, you're interviewing them. Okay, you're interviewing them. Keep an eye and pay attention to their body language. Pay attention to how they greet you. Pay attention to how you feel when you're in that room. Pay attention, guys, because again, the second you start to pay attention to the people around you, and that you can pick up their energy. There's some people who can pick up energy really quickly, and there's some people that can't. I'm a type of person that I can pick up energy real quick. When I get into a room and all of a sudden I start feeling like all this bad energy, or I feel like excited energy, I start looking around, okay, like where is this coming from? Who is it coming from? And what's going on in this room? That's something that you can pick up over time. You start looking at people's body language and things. Body language is very important, okay? If you see that your interviewer is all disorganized and can't remember this or forgot that, or was looking around absent-minded, that's probably not the place that you want to be anyway, because they're going to be absent-minded with you. And that's the last thing that you need is to have an absent-minded supervisor or leader around, because again, what else are they going to forget? Hopefully not anything important. But yes, that's my advice anyway. Look at those positions. If they're asking for too much, that's not the place for you. If they're asking you to do all these other things, and you'll know. Again, don't ignore your intuition. Don't ignore those red red flashing lights in your head. Like, okay, yeah, I gotta pay attention. Don't ignore those. It's for a reason. Always pay attention to your instincts. I'm just saying. So with that said, now I'm going to wrap this one up. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.